Our second webinar in the National Child Protection Week series. I'm Rani Kumar. I'm the Head of Policy and Campaigns at NAPCAN, and it is my great pleasure to introduce this session today. I would like to begin by acknowledging the Ngunnawal people, the traditional custodians of the land from which I speak to you today. I would like to pay my respects to their elders past, present and emerging. I'd like to pay my respects to the elders past, present and emerging of the lands from which you are all joining us today. So welcome to National Child Protection Week 2020. This year's campaign, Putting Children First, is very much about the challenging way that this year has played out. It's been a very complex year for many, and in the midst of all this, we must all remember to put children first. What we do now has an impact on children and our society, both in the short and long term. We're recognising that putting children first means preventing harm before it occurs. It means valuing and celebrating all children. And the conversations we have lined up for this week are very much about helping to illuminate different ways that we can all work collectively to do better for all children. However, before we can get into the conversation between Professor Parton and Professor Higgins, just a little bit of housekeeping. All the webinars we're doing will be recorded and posted on our website in due course. The question function has been enabled today, so please keep them coming throughout the session. If you have any technical difficulties at all today, there is an email address for the NAPCAN team. Please contact them if you've got any issues at all or any questions. If you're a little bit paranoid about the mute function, let me reassure you that this is a listen-only webinar today. You're not able to turn on your camera or your mic. So today we have a pre-recorded session with Professor Nigel Parton and Professor Daryl Higgins, which is as insightful as I'm sure you're all imagining. I know this because I had the privilege of watching it live the other night. We had to pre-record because for Nigel, who's based in the UK, it's currently 5 AM. So please stay with us throughout the conversation. Keep the questions coming. As you can see, Professor Daryl Higgins is here with us live already. Daryl, would you like to say a quick hello?
I really hope that everyone who's joined in today really enjoys the conversation, and I look forward to engaging with you afterwards when we have the question and answer session. So thanks everybody, and I hope you enjoy this conversation.
Hi everyone, we have with us today two outstanding speakers who can shed a lot of light on the complexities and the opportunities of shifting towards a system and a society that prioritises primary prevention in relation to child abuse and neglect. They're in conversation with each other, which I think will make for a really robust and engaging discussion. We have recorded this a few days prior to National Child Protection Week because for Nigel, who's based in the UK, the live session will be at an ungodly and impractical hour. But as mentioned before, please do send us through your questions throughout the session. Daryl will be here at the end to answer as many as he can get to. Any questions that we don't get to or that are specifically for Nigel, we'll take on notice and reply via email. So in conversation today, to unpack the primary prevention paradox, Emeritus Professor Nigel Parton, who is globally renowned for his work in this field and more specifically for his thinking on the politics of child protection and applying a prevention lens. Nigel is from the University of Huddersfield in England, where he's worked from 1977. He's author and co-author of over 20 books and over 100 articles and chapters on the general areas of child welfare and child protection. His most recent books are The Politics of Child Protection and Errors and Mistakes in Child Protection. He was the editor of Children and Society from 1996 till 2006 and has been the editor-in-chief of the open access journal Social Sciences since 2017. Nigel brings a truly global perspective to our discussion today. And with him is Professor Daryl Higgins. Many of you will know him already, and he's been a strong supporter of NAPCAN and Child Protection Week for many years, and is quite the Australian guru on this topic. Daryl has been researching child maltreatment, its characteristics, causes, consequences, and community responses for over 25 years. He is currently the director of the Institute of Child Protection at ACU, Child Protection Studies at ACU, I should say. The focus of the Institute's work is promoting children's participation, strengthening service systems, informing practice, and supporting child-safe communities. We're very grateful to both of you for your time today and for sharing your expertise with us all that are watching. So without further ado, I'd like to introduce the primary prevention paradox discussion. Over to you, Daryl.
Thank you, Rani. Thank you for that lovely introduction, and welcome, Nigel. I'm really excited to be in conversation with you today around this topic. I hope that we actually get to bounce off each other some really interesting ideas, because I know you've been working in this space for so long, and I'm really looking forward to what you have to say. So to kind of kick things off, can you unpack what we really mean by some of this terminology, particularly putting these P words together? What does prevention mean? And what does a public health approach mean? And can you reflect on your knowledge, particularly in the UK contexts, and also in Australia? And I can jump in there too, I'm sure.
Okay. Nice to see you, Daryl. Thanks for that, and thanks for the introductions. I have to say, it all feels a little strange, me sitting in Cambridge in the UK, and while you're all having this meeting over in Australia. Anyway, my particular angle on this goes back very many years, but certainly the most recent book I had, simply called The Politics of Child Protection, concluded by suggesting that a public health model might be helpful, and that certainly ideas around prevention and primary prevention in particular are crucial. My position is, and I like the title of the webinar, The Paradox, because my position is a little ambivalent on some of this, in that the notion of prevention is often assumed to be quite a simple idea, trying to get to things early, trying to make sure that things don't happen further down the line. And therefore, something like child abuse, if you can do that kind of thing, not only will you reduce it, you might be able to stop it altogether. And there's a lot of attractions to that. But the first query I have of myself is quite simply, I don't think it's that simple. I think the notion of prevention is one of these almost apple pie type of words, which is very difficult to argue against. It's very attractive. It pulls a lot of people together. But as soon as you begin to dig slightly further down, it becomes a bit more complex. So that's the first issue. The second issue is that I think when I understand the notion of primary prevention, particularly as that relates to public health, it's absolutely crucial that issues around inequality, particularly structural inequalities, are central and are embedded within the approaches. My concern is that when they're not, and we go straight to what we might call secondary prevention type of interventions, issues around surveillance and civil liberties become much more complicated. Universal services are, for me, crucial. The reduction of inequalities around social class, around gender, around ethnicities are absolutely crucial to some of this. In that respect, it might even be that you don't need the term primary prevention, because if you are concerned with structural inequalities, you should be trying to address those. It might be that primary prevention is helpful because it is perhaps experienced as a little less threatening by some compared to the more political connotations that structural inequalities and the reduction of those might seem. So that's kind of where I am. Primary prevention, crucial. My fear is it's often undersold, and that many of the key elements which are central to it are lost in their operation and application. So that's where I haven't said anything about the UK, but we'll come
No. That's well, maybe you can give some UK examples, because I'd be interested to see as the types of things that you would see from a child abuse and neglect prevention point of view as being the key focus of those primary prevention activities. Because I think from an Australian perspective, one of the things that we often find is that it is a lovely catchphrase to talk about prevention, but we're not really clear on what are the kinds of activities and what are the kinds of settings and who should be responsible for doing those kind of primary prevention activities. And my personal reflection is that we often slide into a much stronger focus around secondary interventions, often quite late in a trajectory of risk. So I'd be interested to hear what you see as the kind of ideal primary prevention activities.
I agree. Well, let me just say something else as a way. It's slightly at a tangent, perhaps, but the other thing I do want to reinforce is that I think nor are we terribly clear about what we mean by child abuse and neglect. So there are concerns about I have concerns about what we mean by primary prevention. There are issues around the key themes and applications of public health. And then thirdly, which if you like, the third part of the triangle, I don't think it's at all straightforward as to what we mean by child abuse and neglect. And I think public health models are much more self-evidently possible when the focus of attention is a much more specific traditional disease model. So you have something quite specific,
or something like that, or smoking.
Whatever. Whereas I think child abuse and neglect is a much more amorphous, broad-ranging, inclusive kind of term, and covers a whole variety of things. So I think that's a problem. Thinking about the UK, those comments are kind of relevant in the sense that there was certainly back in the 2000s, when we had a new Labour government, Tony Blair for much of it, and then Gordon Brown, there was a real attempt to move towards what's called an Every Child Matters agenda. And that came on the back of it. It was sold as the government's response to a very high-profile child abuse death inquiry, one of the many scandals which I'm afraid we have had over the last 40 years. That broadened things immensely to the point that the notion of child abuse and neglect was hardly mentioned. It was in there, but the focus was much more about trying to improve overall child well-being. And so particularly issues around educational performance, well-being in schools, reducing the inequalities in those areas, as well as more basic health provisions were underlined. That government came to an end in 2010, and it very quickly became apparent that that approach was going, and it went very, very quickly. Now, what we do have now, there is an emphasis on what tends to be called early intervention. And again, there's a lot of rhetoric around prevention, brackets, early intervention, but it's a very individualized, specific set of interventions, so that, for example, there's now quite a priority put on adoption, and that is seen as an early intervention strategy. Now, for many of us, that is seen as anathema, which isn't to say adoption shouldn't take place. That is not what I'm saying. But to place it centrally is absolutely missing the point, and I'm sure many of the people who are listening to us today would appreciate some of that. But so the rhetoric is still around, but I'm afraid any kind of context has disappeared. In Scotland, so that was England, I've just been making reference to. In Scotland, they had their own thing, a bit like Every Child Matters, called Getting It Right for Every Child. And that has survived. They have a different political complexion in Scotland. That has survived, and that they are trying to pursue that. But again, you have to be realistic. The way it is going, there's quite a lot of emphasis on increased surveillance, information sharing, registers, all those sorts of things. But they still have the basic framework of that sort of thing. Of course, if you're serious about what I was saying at the outset about primary prevention, things, I'm afraid, around taxation and social security and all those sorts of things have to be quite central. And of course, they're not.
So, Nigel, I'm thinking about the current context in well, globally, but particularly in your country and ours, with the COVID restrictions and the sort of public health focus that many of our lives have taken in an everyday sense. You know, I'm in Victoria. We've been locked down for a number of weeks now. You've had very similar experiences there. Do you think that is helping or hindering, or in some ways changes the capacity of professionals and more broadly the general public around grasping this notion of what prevention actually means for a public health problem like child abuse and neglect in the context of this other problem that we've just been grappling with?
I don't think there's any doubt, Daryl, that these issues certainly brought the basic concepts that we were talking about earlier centrally and made them very high profile. Don't think there's any doubt about that at all. I think for most people, the notions of public health would never be part of their discourse on a day-to-day basis at all. whereas clearly now they are. And what we've been experiencing in our different contexts are slightly different versions of that. There's no doubt. However, I do think it relates a little to what I was saying earlier. COVID is much more consistent with the more traditional disease model. We're not quite sure what it is. We're not quite sure where it is. We're still struggling with basic research, but there's a very clear idea that there is something which eventually we will find and we will be able to do something about in a way which I really don't think applies in quite the same way. So it's useful in raising the profile. It certainly gives us some of the words. It also brings, and you're obviously experiencing it at first hand yourself, it also brings into line some of the basic issues around what a public health model looks like, because it clearly does have very serious implications for restricting civil liberties or surveillance. It's very difficult. I mean, I don't think it's possible to conceive of public health and prevention without recognizing that surveillance is a central mechanism within it, and it must be. I mean, I don't know what it's like with you, but certainly some of these things are becoming a bit more politicized than they were just a few months ago. It's increasingly not straightforward as to how things might roll out in months ahead. Anyway.
Yeah, there's certainly some divergence of views as to what the right approach should be. But I'm particularly interested in the way that COVID has focused our attention on the broad range of actors and strategies that we need to kind of bring together in order to tackle, as you say, a very concrete and more narrowly focused problem like COVID. And we certainly don't expect, you know, the emergency departments in hospitals to be running the show and the only ones responsible for dealing with a problem. We know that there is, you know, much broader public health messaging and the role of employers, the role of public transport, you know, et cetera, et cetera. How do you see that as perhaps shifting the dial, if you like, on the focus around the responsibility that a much broader group of actors, for want of a better term, can take in the child abuse and neglect prevention messaging?
I think that's distinctly possible, and I hear what you're saying, and I think it's interesting and it's important. Whether that is done around issues around child abuse and neglect, or more generally about discussions about public health and the role of prevention in society, I'll leave open. The other thing which I think it has done, which I think is a very positive, potentially positive development, is it's made very clear, certainly in the UK, issues around inequalities. It's quite clear. Or the discussion has to recognise that the impacts of COVID and the restrictions on people's lifestyle is very differential. Like, who's able to stop at home and who has to go to work? Impacts are much greater on those at the bottom of the pile.
Yeah, and particularly here in Victoria, we're talking about those with insecure working, you know, multiple shifts in different settings, and that is driving some of the, you know, the infection rates, if you like, between different sectors.
That's right. Yeah, no, I agree. And that's extremely interesting. So issues around ethnicity also come to the fore, geographical locations, housing, all those things come to the fore in a way which would not have done before. So I think that has very interesting implications. Of course, how we respond, you can't assume that a more progressive, liberal type of, I realise liberal means something different in your context, that a more progressive approach will win over. And certainly, as we anticipated a few months ago, if you like, the clash around, let's call it the public health agendas and COVID, and the economy is really beginning to, I mean, this is, we used to have a phrase here which was used, and people used to say it at the end of conversations and at the end of emails, and was very common across all sorts of discourses, which was simply to finish off by saying, stay safe. Stay safe was the dominant, if you like, shorthand for the times we were living from. Now we're into balancing the risks. I'm not saying staying safe is gone, it's still around, but balancing the risks, because there's an increasing recognition that the staying safe agenda is okay for this, but it might not be okay for that. And issues around the economy and economic generation. I see that Australia's just gone into recession in the light of this. So,
yes.
these are very common implications that we have. And of course, they do have implications directly for children.
Yes.
It's very, 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 very clear that the impacts are quite different in different social locations with regard to children. And it's not just in relation to children are experiencing greater abuse within the family home under lockdown. That's inevitably going to be the case. But also that the inequalities in terms of access to various resources are also very evident as well.
Yes. Nigel, can I just turn us back to the title of today's webinar, and just explore a little bit what we're actually meaning by this term paradox, because to me, I think in the minds of many people, certainly the public at large, but even many people who work in the profession, if you like, in the child welfare sector, it would seem that there is a view about those who need prevention or early intervention services, who need guidance, who need support. That's probably a kind way of putting it. The broader kind of public health discourse is probably the view of bad parents. So those parents who, we need to somehow rescue children from or do something to fix up their deficient or inappropriate parenting. So given that there's kind of this view, how does that sit with a public health approach, which kind of uses quite different language and concepts? And where's the paradox in all of that for you?
Oh, goodness. It's a great title, isn't it? One of the things I've been struggling with for many years is that, and the sorts of things that perhaps you and I and our other, let's say, research and academic colleagues engaged in, is primarily a kind of a rational, logical, some might even say more scientific approach. Whereas I know for many, child abuse and neglect, it's a highly emotive term. The reaction is as likely to be in the gut as it is in the head. Now, bringing those two things together is quite tough. It's quite tough. Yeah. So there's quite a, and as soon as things become emotive, you're either going to get either sympathy or a more punitive approach, probably. So, trying to bring that about, trying to shift the discourse, if you like, trying to bring some of this more scientific, I use that in shorthand, this more scientific evidence to bear is not at all straightforward. I don't know how far you feel that public inquiries, and of course you've had some very high profile inquiries in years, if you feel they can act as a bridge to moving things along in acting in that kind of way, or you might feel that they hinder that sort of thing.
One might use the phrase knee-jerk reaction.
Right.
Yeah, right. I think that's the fear, is that it then creates this sense of we must do something, and it must be seen to be done, and therefore it tends to be the more, from my point of view, the more superficial issues, whether it be increasing, law enforcement or, the number of statutory child protection workers, rather than going to some of those more structural issues that you were talking about in terms of you know, access and equality to, you know, to services and supports that are really the foundation of a primary prevention strategy of making sure that all children and their families have access to those kinds of supports.
Yeah. I was the other day, 2 days ago, I was slightly taken aback, and it was kind of I was looking at the NSPCC website, the National Society for Prevention Courses, particularly their research and publications website. And in recent years, they produced an annual report simply called How Safe Are Our Children, where they bring together a whole variety of different statistics on numbers primarily, about how many, what sort, how it's changed, etc. And interesting, not the last word, but an interesting document, particularly when you look at them year on year, and only to find that this year they're not doing it. And it says on their webpage, this is now, you may well be aware of this is now been taken over by the ONS, the Office for National Statistics, basically a government department. Oh, that's interesting. So I went to have a look, and I had a look at it, and I've printed it off. And there's lots of statistics. It's produced by the Home Office, the Crime Division. This is fascinating. This is fascinating.
It does say something about how you know, the idea of child abuse and neglect prevention and keeping children safe is framed.
I've got it here, though. I don't want a lot of time looking for it. It's around because it was such an interesting and powerful experience. And then the head of the statistics that's put this document together, so a scientist, a statistician, if you like, but immediately moralizes the issue, because it's a terrible thing, and there are vulnerable children. Well, yes, but if you've only got 3 lines and you're the chief statistician, to suddenly shift it like this, and I have to say, I was taken aback, and I suspect, but it's not the Department of Health, it's not Education and Children, it's the Home Office, and it's basically using the criminal stats and the annual crime surveys to put the stuff together. That was a big statement for me. They're trying to, and I'm not saying that crime and disorder isn't, some elements of it aren't sympathetic towards moving towards a more population-based public health type of approach. So it's not saying, but so it's a crime.
Yeah,
they are a set of crimes.
Yeah.
Just going back to your point, I think that would reflect what many people would say. Yes, they are crimes, and they need to be punished. And practitioners in this country, primarily social workers, need to be held to account when things go wrong. And I'm not sure that things have got any better in shifting the discourse in recent years. I'll be honest. I fear that more punitive, moralistic dimension to things has probably got stronger, but I have no basis in that simple anecdotal, if you like.
So Nigel, No. I totally agree that I think you're pointing out a really important issue, and you know, I often draw the analogy when I'm talking about a public health approach is that, you know, if you were talking about prevention of crime, you wouldn't hand over responsibility of it to the prison wardens. You know, you have to involve a whole broader group of people in that task. So I think what you're saying really is a problematic but good illustration of that issue. But here, I'm sure for the listeners hearing you and I talk about this, where we've convinced ourselves that, you know, a public health approach sounds like it's the right, you know, ideological approach, but what's the downside? What's the risks associated with kind of trying to adopt that you know, public health oriented focus on primary prevention activities. What's the risks? And conversely, what's the risks of not adopting that approach?
Yeah. The risks of adopting it, I would say, include the following. It could be, this is all possible, question marks against all of them, but it could involve you actually miss the specific cases. If you're primarily concerned with more population, community-based approaches, you might miss the specifics, question mark. Undoubtedly, it increases the surveillance approaches, potentially for the total population, which has implications for privacy, for civil liberties, the boundaries between the private family and the state, potentially.
And as examples of that, are you talking about things like drawing in the role of GPs and teachers and early childhood educators and so forth to be looking out for children who might not be doing so well and parents who might be needing support, that kind of surveillance?
Well, that kind of surveillance, and if you like, there are two things I'd underline to reinforce that primary prevention, you're trying to predict, you're trying to anticipate, so you're looking for early signs. They might be right, they might be wrong. You might, in some cases, it will be very helpful. In other cases, it misses the point completely. So that's one. But the other side of the surveillance conundrum is that the sharing of information is crucial. And of course, you know, the more the information technology expands, and it must have expanded exponentially in recent months, and the more professionals that are involved, the more information that gets shared. So, and it might well be that people simply are not aware of all that, its implications, and how it might be used. So I think there's a whole raft of issues, potential negatives around the surveillance, civil liberties, privacy, role of the state type of thing. I suppose, and coming at it from a different point of view altogether, it could be also be argued it's expensive. Why on earth would you want to spend all that money and all those resources in that kind of way? Is it a good use of resources? I mean, that's something that you and I probably wouldn't engage with, and we'd probably say, well, actually, down the line, you save money. Because various tertiary services would not be required in the same kind of way. That
so a smaller, leaner statutory child protection service and kind of, you know, therapeutic services for children who have been harmed, and remediation of parents who need support to be able to safely care for their kids. Yes, I'm interested because I know that you've written about some of the problematic nature of the inexact science that we have around risk. And one of the things that you pointed out is that we, in sort of establishing the statutory child protection system as sort of monolithic and ubiquitous as it is, in kind of Western democracies, Anglophone countries in particular, that we underestimate both the scope and the complexity of the problem of child abuse and neglect. Do you want to talk a little bit about what you mean by that?
Well, I mean, you touch on that, on some of the things you've written yourself, particularly in the introductory chapters you had in your Revisioning Public Health book. Basically, that one
right here, and thank you for your three.
Right. It looks a bit like that. But it's essentially the individualized systems that we've had in place now for 30 or 40 years haven't particularly worked. And I think there's now quite a consensus that is, and considerable amounts of evidence from different jurisdictions that is the case. And we've also attempted various reforms of those systems in the probably the last 20 years. And I know that most of the states in Australia have engaged in that. There seems to be revisions of the system and the structural capacities of the agencies all the time. So in that respect, the public health model comes along. But what it also does, and I think it's great, one of its great advantages, it recognises actually that it's highly likely that these more narrowly focused, individualised systems are ever going to cope with it. You know, it basically cannot be done. So one of the basic premises which has drawn me to a public health type of approach is that if we're serious about doing something about child abuse and neglect, which is pretty broad term, but and now covers a whole variety of different things which are way beyond the battered baby syndrome 40 years ago. You really do need to take it seriously and to try to ensure that you have systems, policies, practices, services in place which are seriously going to do something about it. So that's prevalence, if you like, is much bigger than the number of cases that ever come the way of existing agencies, even though those numbers have gone up hugely over the last 30 years.
So to kind of rephrase that back to you, are you really saying that the size of the problem is actually bigger than we really realise, and therefore a public health oriented solution is actually going to deliver us benefits that we don't even currently kind of anticipate because we're not actually fully recognising the scope of children and their families who are in need and could benefit from those kind of broader approaches?
Yes. Yeah.
It was a bit of a Dorothy Dixter. Sorry.
No. Thank you.
So, how do we kind of get the make the bridge, if you like, between where we are now and where we want to be, given that in the public mind there often is this view of, well, we know who are the families in trouble, we know who we need to be removing these children from, and of course you mentioned before those you know, the inquiries that occur, you know, especially after there's been, you know, a catastrophe and God forbid a child dies. The system, you know, does the wrong thing and we react to that. But in all of that, the public still often has the view of that bad parent, those group of parents over there. How do we kind of draw in a broader sense of support then for having a system, or in fact, you know, maybe interconnected systems that are meeting a much broader group of families' needs?
It's a huge challenge. I'm not so sure if it's the public. I'm not so sure how much of it is that certain politicians are drawn down that kind of route, and you might argue they're simply reflecting the broader public. I think for many, they don't particularly have views about it. It's kind of a bit of the world which they are quite happy not to engage with. So that's that. But in terms of trying to move a public health agenda forward, I mean, referring back to your when you alluded to the COVID crisis and how that, I mean, it may well be, I mean, that's what I suggested at the end of my Politics of Child Protection, that the place to take it in terms of developing it in the future in the UK context was public health departments. And they were cut back hugely because they're part of health, and therefore it's not been helpful in the current crisis. Public health departments have been bypassed and they haven't had the basic resources in order to do the job which they would have been in a good position to do currently. So it may well be that the argument is about trying to raise the profile and pursue public health strategies simply under the rubric of public health departments, of which child abuse could be in there. Well, you'd imagine that children are going to be in there. you can imagine that families are going to be in there. So maybe that's one way in which it could be done. I don't know what the situation is in Australia and the various states. What is, I don't even know, is public health a state or a federal responsibility? Oh dear.
Well, it's interesting. I mean, it's called different things in every state. Usually it's a functional area within a broader Department of Health. Sometimes it's even combined with Health and Human Services. Here in my home state of Victoria, that's where it sits. I think what's interesting for me, though, is here in the COVID context, for almost the first time in my life, there's actually been public profile for those experts. So they're standing alongside prime ministers, state, territory chief ministers and premiers, and I'm sure you've got the same thing in the UK. So in some ways, is that an opportunity for us to kind of jump on that bandwagon of having different professionals who can kind of steer this ship for us, if in fact, but can that only happen if we actually recognise that is a crisis of the same scale that we're seeing with the COVID-19 crisis, which allows us to put forward that expertise and to rely on it and to almost hang on every word that they say.
Yeah, no, I think that's interesting and helpful, and it's a position I'm moving towards. As a bit of an aside, Public Health England is in the process of being scrapped.
Okay.
Well, it's quite, you know, it's pretty basic politics. It's very difficult to argue that the way it's been handled here has been a success, and therefore politicians are looking at the blame game as to how they've been failed. And Public Health England is seen as, and there's no doubt there are problems with it, but so that's going to be replaced by something else, which is basically an organisation almost certainly supported by the private sector, but it basically on the test and trace system. So test and trace has been a bit of a disaster. It's said to be world beating, but Public Health England is going to be replaced by an organisation which is basically driven by the test and trace system. So I think the argument holds. I think it's well worth looking at. I think it's well worth pursuing. But this is definitely part of the paradox. There's all sorts of odd things going on which you would not have anticipated a few years ago. So profiles are raised, but of course, in the process of profiles being raised, you then enter into the firing line, and here people have been in the firing line.
Yes, yes. And it is hard to maintain the rage and to maintain the focus when there are so many other distractions. And of course, you know, COVID is the biggest one that we're all facing globally. How do you think, though, that might be doing things like exacerbating some of those inequalities that you were talking about earlier on today? And what do you think the opportunities are from here, given these incredibly unique environments that we find ourselves in?
Yeah. Well, tomorrow is a very big day here, because tomorrow is the day that kids are supposed to go back to school. And they're all supposed to go back to school. And for many, in fact, for most, they've not been in school for 6 months. So it's a big issue. And even our government has been forced to recognise that certain sections of the population have been missing out badly, and they need to go back to school. So this is where, you know, the balancing the risk. It's not just staying safe, it's now balancing the risk. So is it a bigger risk for kids to be out of school or in school? Well, the situation we're moving to is that they need to be in school. But as you have yourself, as we speak, we're moving to a situation whereby it's not national lockdown, it's local lockdowns. So certain places are being, and they, of course, they do tend to be the poor areas. Where the local lockdown is taking place. But I do think what it's focusing on is that children's welfare and children's education is central, and it's been compromised, and many kids are, it's said that a whole generation could be lost if we're not careful. So that, and I think that is not an unreasonable position to take vis-a-vis. So what is child abuse and neglect? Well, it looks to me as if there's a lot of kids out there who are being neglected in the context of what's going on in relation to education and basic support. So the debate is certainly not in terms of a framework of child abuse and neglect prevention, but there is a recognition that kids need to go back to school and need to be supported. So we have some interesting things going on about school meals, preschool meals. We mustn't have hungry children. Well,
yeah,
that's about as I mean, it's a grim situation, but in terms of trying to move strategies forward, it's about as positive as we are likely to get. And as you said earlier, things are now being discussed and people are being profiled who just weren't 6 months ago. So we'll see. We'll see.
Yeah. And it's interesting, we've been talking and using the language of risk a little bit today, but you really just touched then on what I would be calling protective factors, you know, those resilience promoting things such as access to education, even the whole, you know, provision of meals through schools is addressing at a structural level what we may say could be an individual risk factor for a child or a particular family where they're not, whether it's because they don't have the adequate resources, but children are the ones who are missing out. So it's interesting that, you know, that we could have this shift, perhaps even triggered by, you know, a global pandemic, like that this could be the motivator for us to really recognise the value of some of these wider scale primary prevention strategies that, you know, that we believe are really critical. We're nearly out of time, Nigel. So any final thoughts on this paradox, if you like, of how we can get targeted focus on those who need it most, but provide broad supports to, you know, to all families and children in need?
Yeah. Just to complete that last point, I think it does connect. I think it's a very interesting example that the move towards ensuring that kids get enough to eat, and particularly in schools, to get them into schools. There's a lot of support coming from some rather large supermarket chains, which is very interesting indeed. And if it's possible to bring some other institutions on board, which you don't recognise normally as being relevant to this kind of thing, I think that's extremely helpful.
So supermarkets as a child protection service.
Well, so maybe that's not quite the place to leave this, but not to be dismissed. Yeah, very
absolutely. Good. But we're recognising that we need coordinated efforts across multiple sectors, multiple actors, if in fact we're going to drive a well-being and a prevention, primary prevention strategy right across the country. Yeah. Look,
very good.
Thank you so much for your time today. It's been a real pleasure for me to be able to be in conversation with you and exploring these fascinating issues. It's been a real pleasure, and thank you for your time. All the best in the UK for you and your colleagues and family.
Very good, and to you, and many thanks for the invitation.
Pleasure.
Wow, thank you. I hope you enjoyed that as much as I did. Lots of threads to pick up on there, Daryl. We've had some really good questions come in throughout that, and some of them do relate to the topic for today, this paradox of prevention, which I know came up in your discussion with Nigel then, and I felt like maybe you had a little bit more to say. I know that in our work, we find that people find prevention a bit paradoxical, in that you're taking a whole lot of actions to prevent something that may happen, and success looks like it not happening. And I think that with this pandemic and the response, people may be understanding the public health approach a bit more. Did you have any more thoughts that you'd like to share on that?
Yeah, look, I think there's a number of elements that are paradoxical. You know, trying to stop something from happening certainly is much harder to conceptually get around your head than doing something. You know, most of our other systems, you know, you're talking about educating children. You can say you want to increase their, you know, their NAPCAN scores or their ATAR scores or whatever it is. It's a concrete thing that you're trying to improve. Whereas with child abuse and neglect prevention, it's more of an invisible thing. But I think one of the ways of resolving some of that paradox is to be able to identify some concrete steps that we actually want to build that are based on eliminating those risk factors and building the positives, the protective factors. And so those are concrete steps, you know, and I think a really concrete example for me is building parenting capability. You know, we know that that's one of the key ingredients for protecting children. So rather than talking about stopping neglect or stopping physical abuse or stopping any form of child abuse and neglect, what we can talk about is, have we improved the knowledge and the skill and the capability of parents to be able to provide safe and supportive environments for their children? That is observable, it's measurable, it's also a positive thing. So being able to kind of shift some of that language in the primary prevention space, I think will help people to realise that it actually is quite tangible. It's not this kind of theoretical thing.
Thank you. In relation to this approach in building parenting knowledge, inequities came up a few times in the conversation, and the moralising of this issue, the bad parents that are over there. What are your thoughts on this in terms of the structural issues at play here? What does that mean, a prevention model for abuse and neglect?
Yeah, look, I think there are a lot of structural issues. Sometimes it's ones around education. It's also ones around access to positive role models. So if you happen to have been fortunate enough to have grown up in a family that wasn't characterised by family violence and that wasn't characterised by, you know, use of corporal punishment, which is a euphemism for physical abuse in most cases. And in fact, if you grow up in the care of your biological parents, as opposed to growing up in an out-of-home care environment, you know, those are all kind of structural risk factors, if you like, that we need to be addressing. And of course, if you're focusing very much on the kind of day-to-day existence of, am I going to put food on the table, probably less likely to be able to be paying attention to the emotional well-being of your children. And that's not to say that all families from low socioeconomic communities do a worse job of parenting than other families, but they do it under greater stress and with less supports. And so I think finding ways of being able to engage with them in ways that are meaningful and appropriate to their level of need and their context. And clearly those kind of broad level structural inequalities that Nigel was speaking about, I wholeheartedly agree that that's sort of the first platform of primary prevention.
Absolutely. Nigel also noted that it's an emotive issue when we talk about child abuse and neglect, and it's not a straightforward process to bring in the scientific knowledge. Some of the things that you're saying there about the structural issues as well, we know a lot from research what the impacts of these things are and the intergenerational impacts as well. He mentions public inquiries as a possible bridge, and we've had a question related to this from someone working in a collective impact group. She's asking what you think the importance is of community knowledge and discussion in breaking cycles of abuse in families. What do you think in terms of public understanding of this, and how can we bring these issues to light in a way that's safe and non-stigmatizing to do the best for our kids? Sorry, have we lost Daryl there for a second?
No, Daryl? Sorry, I turned my screen up because I you dropped out, so I turned my webcam off just in case that helped. Can you just repeat the question again?
Oh, absolutely. So I was saying that we've had a question from someone who's working in a collective impact group, and she was just asking, what importance do you think community knowledge and discussion play in breaking cycles of abuse in families? How can we bring these issues to light in a way that's safe and non-stigmatizing for families and children? So it's that sense of how do the public understand this issue?
Yeah, look, I think community norms are really, really important, particularly for parenting practices. And we know that most abuse and neglect goes on within families, notwithstanding, of course, the very strong focus that we had with the Royal Commission about child sexual abuse within institutions. But even with that, we know that, you know, most abuse happens within families. And so changing attitudes of the community is likely to shift attitudes that we have to what goes on in the privacy of your own home. And we see plenty of examples of how public health campaigns can change those personal behaviours. So wearing seatbelts in cars, you know, if you talk to people 50 years ago, they would have said, oh, it's my right to be able to, you know, drive the way I want, etc. Whereas we now all understand through changing community attitudes that in fact this is an important safety feature. And even though I might say I'm a very safe driver, I don't really need to do this, we all do it for the good of the community, and we all benefit by all kind of playing our part. And that's what I love about the, you know, the NAPCAN tagline, play your part, is that it actually helps change the narrative, if you like. And I think that there's a lot of work that we can do. And so I'm glad that that question was raised around the value of kind of, you know, these collective impact. And we see a lot of examples in Australia and elsewhere around these kind of place-based initiatives that brings together actors, if you like, around a shared goal for their local community.
Thanks, Daryl. I really think that there is a real role here around framing child protection and prevention as well, which you brought up in the conversation with Nigel. In relation to these community level interventions, if you like, do you have some examples you'd like to share as a last bit to share with our stakeholders, some food for thought as they go on with their work?
Yeah, well, look, I think we've seen a number of examples, and I don't want to just focus on one community, but, you know, there's been a lot written about and talked about at conferences from Logan Together, and I know that we have someone on the line today who's from Southern Moreton Bay Islands, and we've got Communities That Care. There's a number of initiatives that are really trying to bring these different actors together. And so I think we have to understand what's the key ingredients. So it's people with local knowledge, local community trust, who can bring together these different players. And so it can be schools, it can be early childhood settings. We know that playgroups play a really important role because they're non-stigmatizing ways of drawing in and being able to reach out, therefore, to all families. And we know that it's not just targeting through those mechanisms those families at high risk, but in fact, children right across the community do better when all families get the support they need to improve the well-being of children within their local community.
Absolutely, and what a strong point to end on. Thanks so much, Daryl. You did an amazing job getting through these questions at the end in the 10 minutes that we had. And we will get back to any questions that we didn't manage to get through today via email. I'd like to extend my sincerest thanks to both you and Professor Parton for your time and for sharing your expertise with us all. I'm sure we've all gained new perspectives and ideas that we may think about our work differently and our engagement with our communities. I hope we can work together as a sector to progress primary prevention in relation to child abuse and neglect. Thank you all for taking the time to join us today and supporting National Child Protection Week webinar series. There are still a number of webinars to go this week, so please do register and hope we see you online again. We will send a copy of this recorded webinar through to your emails with some key learnings in the next month or so. There is a short survey as you hop out of this webinar. We really value your feedback and appreciate if you could take a few minutes just to complete that. Thanks again, and bye for now. Thank you.